Hello and welcome to my channel. In this video I'm going to explain pneumonia. I'll start firstly from epidemiology of pneumonia, and then I'll go to definition, causes, pathophysiology, clinical picture, diagnostics, and treatment of pneumonia. So make sure to subscribe to my channel and like this video. So let's start. Pneumonia is actually a common illness. It affects approximately 450 million. So 450 million of people are affected every year by pneumonia, and it occurs approximately in all parts of the world. And it is a major cause of death among all age groups. It results in 4 million deaths every year. So this number equals 7% of total deaths every year. So pneumonia is a common illness and it is dangerous actually. Rates of deaths are greatest in children less than 5 and adults older than 75 years. So less than 5 years and above 75 years are at a higher risk of death due to pneumonia. Pneumonia actually occurs about 5 times more frequently in the developing world versus the developed world. The viral pneumonia accounts for about 200 million. So 200 million of cases by pneumonia is caused by viruses. So after epidemiology, let's go to definition of pneumonia. Pneumonia is defined as an inflammatory process. So it is inflammatory process and it is actually infectious. So it is an inflammatory process of infectious origin affecting the pulmonary parenchyma. So this definition is from BRS pathology book. Next definition, pneumonia is defined in Oxford Handbook of Clinical Medicine as an acute lower respiratory tract illness associated with fever, symptoms and signs in the chest and abnormalities on chest x-ray. So from these two definitions, we can mark the following key features of pneumonia. So it is inflammatory process, infectious, affecting pulmonary parenchyma, associated with fever and abnormalities on X-ray. So abnormalities on X-ray is the most significant feature of pneumonia. I'd like to add another key feature for pneumonia, which is acute. So pneumonia is only acute. There is no chronic pneumonia. Let's go to causes of pneumonia. Pneumonia is caused by bacteria mainly, but also it can be caused by viruses. The most important bacteria are Streptococcus pneumoniae, Staphylococcus aureus, Chlamydia psittaci, Mycoplasma pneumonia, Legionella pneumophili, and Klebsiella pneumoniae. From viruses, there are the influenza virus, measles, herpes simplex, adenovirus, cytomegalovirus, and coronavirus. So there are risk factors for developing pneumonia, which increase the possibility of developing of pneumonia. So here are the risk factors. The first one is smoking, alcohol abuse, pollution. So air pollution is one of risk factors for developing pneumonia. Age over 65 years, respiratory infection or respiratory disease, especially influenza. So diseases caused by influenza virus. And corticosteroid therapy. Corticosteroid can develop immune deficiency. So when there is a deficient in immunity, the person can develop many diseases. One of them is pneumonia, in addition to HIV as a risk factor. So pathophysiology of pneumonia. In order to develop pneumonia, there are 3 mechanisms that should be present in the person. So the first one is bronchogenic mechanism. The bronchogenic mechanism means when there is a disorder in the function of the mucociliary escalators. So if the mucociliary escalator is disordered, it cannot remove the pathogens from the lumen of the bronchi. When a pathogen enters the lumen of bronchi, the bronchi will produce mucus, and the mucociliary escalator will try to move them outside the lumen of bronchi. So if this mechanism, if this function is disordered, the pathogens will have the possibility to go inside the bronchi, reaching the alveoli. So keep in mind the bronchogenic mechanism. The next one is hemogenic mechanism. So the second mechanism is hemogenic mechanism. It occurs when there is sepsis in the body. So when there are accumulation of pathogens such as bacteria or viruses, they reside inside the body and they go to different parts in the body. They make a great possibility for developing pneumonia. So the next mechanism, it is lymphogenic mechanism. In this case, occurs a deficiency in immunity. So when the immunity is deficient, such as in the case where the acidity of the gastric juice is decreased, it makes a great possibility to develop various diseases, especially pneumonia. So keep in mind these three mechanisms: bronchogenic mechanism, hemogenic mechanism, and lymphogenic mechanism. So let's go further into how this disease develops. So the first step after developing of these three mechanisms occurs reproduction and the growth of microorganisms in the bronchioles. So a pathogen enters through your mouth or through your nose, reaching the bronchi. If the bronchogenic mechanism is present, the bronchi isn't able to remove the pathogens due to disorder in the mucociliary escalators. So the pathogens reach into bronchioles and they reside there and start to reproduce and grow there. So next, after residing of microorganisms, they make inflammatory exudate. The contents of this exudate are WBC, leukocytes, fibrin, and the fluid. The migratory cells, such as neutrophils, macrophages, and lymphocytes, reach into the inflammatory site. So this makes the inflammatory exudate accumulate in the alveoli. So here the story begins. Story of pneumonia, of course. So here we see a draw which shows the condition of alveoli in pneumonia. So if we make a zoom into the alveoli, here we see the normal alveoli. Alveoli are responsible for gas exchange, but in pneumonia, the exudate resides in the alveoli. So here we see an exudate in the blue color. So here we see an exudate in the yellow color. And this condition occurs in pneumonia. So let's go further to the clinical picture of pneumonia. Pneumonia is characterized by a cough, which is painful and dry at first, but after, let me write this note for you, it is very important. After 2-3 days, the cough becomes wet due to excretion of sputum. So the sputum can be in two variants. It can be mucopurulent sputum. If the sputum is rust colored, the pneumonia is caused by Streptococcus pneumonia. So keep in mind these two bacteria, which are the most important in developing pneumonia. So next symptom is dyspnea and chest pain. Chest pain especially occurs in the affected lobe. So remember, please, chest pain occurs only on the affected lobe. Also, fever. Fever ranges from 38 to 39 in pneumonia. It can be less in some cases of pneumonia. Also, other signs which are rigors, shivering, and malaise, as well as delirium, anorexia, and headache. Fever, headache, and anorexia are signs of general intoxication. So remember that, please. Rigors and shivering are mechanisms to decrease fever. Let's go further to classification of pneumonia. Pneumonia is classified according to the etiology of the disease into community-acquired, hospital-acquired pneumonia, aspiration pneumonia, and pneumonia in patients with immunocompromised patients. So, states of pneumonia. The first stage, which is the initial stage, is characterized by a sudden onset of the disease. So, pneumonia starts suddenly with chills and fever. And of course, severe asthenia. Asthenia means general weakness with malaise or headache sometimes. In addition to dyspnea, cough, and chest pain. So if a patient develops suddenly these signs, make sure to check pneumonia. The cough is short and dry, and after 2-3 days it becomes wet with expectoration of sputum. Also, another signs which is hyperemia in the cheeks. So the cheeks become red and the lips become sore, and in addition to tachypnea and cyanosis. The lobe affected in pneumonia becomes retarded. So retardation of the affected lobe is a characteristic feature for pneumonia. Next, the peak stage. In this stage, the patient condition becomes severe. It becomes worse, developing tachypnea and tachycardia, and the blood pressure decrease, and sometimes occur even collapse, especially in severe pneumonia, and delirium and hallucination continue. And of course, the retardation of the affected lobe persists. And in the next stage, which is the resolution stage, this stage is characterized by dilution of the exudate. So the exudate begins to dilute. In the last stage, this stage appears on the eighth day after the onset of the disease. The patient condition improves, so no temperature, or temperature becomes normal, no dyspnea, no systemic signs, and no chest pain. Diagnostics. So to diagnose pneumonia, there are laboratory methods and instrumental methods. From the laboratory methods, there are the blood test and sputum study. In the blood test, we can detect the general signs of infection, which are leukocytosis, elevated ESR, and elevated C-reactive protein. In the sputum study is very important to diagnose pneumonia and to differentiate between pneumonia and tuberculosis. In the sputum study, we can detect the bacteria, or we can detect the pathogens which result in pneumonia. And also another important instrumental method to diagnose pneumonia, it is X-ray. Show you in the next slide how X-ray looks in pneumonia. So here is lobar pneumonia and here is the bronchopneumonia. So in lobar pneumonia, only one lobe in one lung gets affected by pneumonia. Here we see the white color on the affected lobe. Make sure to know that the dark color represents air. So here is air, the dark color, and here's also air. In pneumonia occurs collapse of the affected lobe. So if the lobe is collapsed, there is no air. So it shows as white because there is no air. But if you see more than one lobe in white color, it is bronchopneumonia, when there is more than one lobe affected. So here we see a white color, meaning no air, and here we see also another side where there is no air, so there is bronchopneumonia. So treatment of bacterial pneumonia. So here I prepared only the treatment for bacterial pneumonia. So as etiological treatment, we should use antibiotics. It is preferred to use 2 antibiotics to treat pneumonia, as we will know in the following. So there is amoxicillin, clarithromycin, erythromycin. So let me change the color. So amoxicillin, clarithromycin, erythromycin. And for Staphylococcus aureus, we use flucloxacillin, clarithromycin. And for Mycoplasma or Legionella, we use clarithromycin or erythromycin plus rifampicin, but as I said, it is preferred to use the combined therapy for pneumonia. In severe cases of pneumonia, clarithromycin or erythromycin plus amoxiclav, ceftriaxone and cefuroxime, amoxicillin plus fluoxacillin. And also, in addition to antibiotics, of course, we do oxygen therapy and we use non-steroid anti-inflammatory drugs in order to treat fever, headache, and general intoxication. And also, we use intravenously fluids. So this is the treatment of pneumonia. The next type of pneumonia is the hospital-acquired pneumonia. Hospital-acquired pneumonia occurs after 48 hours after admission to hospital. So if the patient develops the signs of pneumonia, such as chills, confusion, headache, chest pain, cough, after 48 hours, we should directly think about pneumonia. And if the patient gets into the hospital at, let's say, 12 o'clock and at 19 o'clock develops pneumonia, make sure this is not hospital-acquired pneumonia. This is community or another type of pneumonia. Because as we said, hospital-acquired pneumonia needs 48 hours for development. So this is, guys, what I got for pneumonia. Thanks for watching, and make sure to like and share and subscribe to my channel. I wish you all the best and see you later in next videos.